Welcome back. We're talking to Dr. Steven Chow about drug addiction and newer methods of treatment. Doctor, where we left off just now, were you going to elaborate on what some of the efforts the medical society or the medical community is doing to treat drug menace in the country?
So, Lucinda, in the past, in fact, before 2002, there was virtually very little medical input into handling the problem of drug addiction in this country. And about that year, there was launched in this country a specific treatment for heroin addiction. And that's where the medical committee under the Federation of Private Practitioners decided this is going to be one of our social responsibilities. And we took on a program called Drug Addiction, Ask Your Doctor. Okay? And with that, we went about organizing a care group called Doctors Who Care. Okay? And we recruited and trained doctors around the country to treat patients. Okay? Among the sort of things we did, okay, of course, is number one, to be providing the input in training. So we went about training the doctors, training the counselors. Okay? We went about a program, in fact, where we provided community-based treatment, i.e. the patients come from the community, gets treated in the doctor's clinic, and goes back to the home. Okay? So we feel this is the most, in fact, cost-effective way of treating rather than incarcerating the patient. Okay? And the message to town is that, no, drug addiction is a disease. It's a mental disease, a brain disease. Okay? And there's a specific treatment for it. Okay? In fact, the addiction problem can be explained in very specific biochemical pathways in the brain. Okay? So once that is accepted, then the paradigm shift allows treatment to be done at home. And that's why we are concentrating our efforts. We train the doctors, and to date we have trained more than 620 doctors nationwide. And together they treat more than 21,000 patients, okay, within the home setting. We then partner with other bodies, with the Ministry of Health, because we believe this being a difficult problem must be monitored. There's good medications, there's good doctors, there are also good patients. Okay? Likewise, there are also bad patients. So we do not want the situation where the whole system go haywire. So we created what we call a drug substitution therapy register system, okay, where we monitor the doctors as well as the patients as well as the medications itself. And this is an online, okay, real-time system. Okay. It prevents people abusing the system. Okay. We partnered also with the agent anti-dada kebangsaan to look in how we can improve outreach programs, how we can help, and how they can help us as well. Okay? And of course with the media, okay? And with the various NGOs, the faith-based rehabilitation groups. Okay?
How has the response been?
The response has been tremendous, I must say. The response has been so exciting that all other parties seem to be jumping on board now. You see. So we hope the day will come, in fact, where there will be amendments to the law that actually allows, legally allows you to treat in a community. Otherwise, the law still exists where if you are a drug addict, okay, it's correct to catch you and lock you up for 2 years in a rehab home. Okay. We hope that changes now.
So what are some of the newer methods? Okay, the old rehabilitation programs doesn't seem to be working. You're confident this is more effective?
This is definitely more effective. In fact, our retention rate is way beyond 70% of the treated population. Okay? This is by no means a cure. Okay? It allows the patient to at least get back in grips with reality. Okay? And from there, the people who specialize in rehabilitation, in counseling, can then come in, okay, give their input and help the patient out of drugs, as well as perhaps in due course out of the treatment program itself, and live a normal life. Okay?
Yeah. And then, Doctor, you were also an advisor for the Jiwa Baru outreach health program. Can you tell us a little bit more about that?
See, one of the main targets that we are trying to reach are those people who are not under treatment. We know there are lots of them out there. They may not be aware that there's an effective treatment. Okay, they may not be aware that there are NGOs out there who can help them. Okay, they may not be aware that there has been a paradigm shift among the policymakers and regulators that perhaps community-based treatment is allowed nowadays. And Jiwa Baru essentially means a renewed spirit. Okay, so it is an outreach program to educate the people, to reach at the hidden, untreated population. And to tell them, look, treatment works. We have treatment that works. Come and get it, all right? And you'll be able to live a normal life. Okay? A productive life, not a life of drugs and crime and degradation.
So how can a community help? I mean, how can the public help and participate in this program?
First thing, they must accept the fact that the problem is not just social. There is a disease involved. Okay, all right. There are numbers in Jiwa Baru which you can call. Okay, they can volunteer themselves. Okay, I'm sure many people out there know of someone close to their heart within their family who is on drug, who needs help. Okay, and these are the people you will refer for treatment. Okay, go and find your nearest family practitioner or general practitioner who has been trained in this area of treatment and get them to help you. That's the first step. Okay, to be able to come forward and seek help. Okay, don't hide behind in denial and say, no, it's something I can handle. No, perhaps it'll go away tomorrow. It won't, because the problem is actually beyond an individual. He is just not able to handle his addiction. Neither the family can handle it. In fact, even the one society can't handle it. It needs all parties to be putting together their effort to help him.
Yeah, ignoring the problem isn't going to make it any better.
And don't stigmatize because someone is on drugs. Say, hey, this guy has got no hope, no future. He's worse than an animal or whatever it is. I mean, it's obviously someone's son, someone's daughter, and it's worth every effort to help him.
Okay, thank you very much, Dr. Steven. From all of us from Studio V, I'm Lucinda Joseph. Thank you for watching.